Trochanteric bursitis is a condition that causes pain and inflammation around the bony protrusion at the outside of the hip, the greater trochanter. The condition is caused by the overuse of the leg muscles that attach to the bony protrusion. This can happen from activities that involve repeated hip extension, such as running, stair climbing, or dancing. Trochanteric bursitis can also be caused by direct trauma to the area, such as a fall. Trochanteric bursitis is a type of inflammation of the bursa. The bursa is a small, fluid-filled sac that acts as a cushion between bones and soft tissues. The bursa is located near the shoulder, elbow, hip, and knee. The condition is treated with a combination of rest, ice, and nonsteroidal anti-inflammatory drugs, NSAIDs. Physical therapy may also be recommended to stretch and strengthen the muscles around the hip. Surgery is rarely needed. If you think you may have trochanteric bursitis, it is important to see a doctor so that the condition can be properly diagnosed and treated. There are several possible causes of trochanteric bursitis. 1 is overuse. If you walk or run a lot, or if you participate in other activities that put stress on your hip, you may be more likely to develop the condition. Another possible cause is injury. A direct blow to the hip or a fall can cause the bursa to become inflamed. Age is also a factor. As you get older, your bursa may become less able to withstand the stress of activity and more likely to become inflamed. Trochanteric bursitis is a type of inflammation of the bursa. The bursa is a small, fluid-filled sac that acts as a cushion between bones and soft tissues. The bursa is located near the shoulder, elbow, hip, and knee. The most common symptom of trochanteric bursitis is pain on the outside of the hip. The pain is usually worse with activity. The pain may also be worse at night. Other symptoms of trochanteric bursitis include swelling on the outside of the hip, tenderness on the outside of the hip, pain that radiates down the leg, limited range of motion of the hip.